Insulin by syringe and vial. The school nurse, when available, is the most appropriate person in the school setting to provide care for a student with diabetes. However, many schools do not have full-time nurses. Even for schools that do, the nurse may not always be available at all times during the school day, during school-sponsored extracurricular activities, or field trips to assist with routine care and emergency care. Trained school personnel must be available to perform and assist the student with diabetes care tasks. This presentation is not intended to provide legal or healthcare advice. Please consult with a legal or healthcare professional regarding your specific questions or needs. Each training component was created specifically for school nurses and other qualified healthcare professionals to train school personnel. This unit is insulin by syringe and vial. Participants will be able to understand types of syringes and where on the body to inject insulin. Participants will also be able to demonstrate how to dose with the syringe and how to inject with the syringe. In addition to understanding insulin dosing and delivery using a vial and a syringe, it is important that those administering insulin to a student or assisting a student with insulin administration understand the fundamentals of insulin action, dosing, and delivery. These general concepts are covered in the unit entitled Insulin Basics. The method of insulin delivery is determined by the student, parent, guardian, and provider, and therapy may change. Some students may only ever use insulin injections, while others may transition to insulin pump therapy, which will be discussed in another separate unit on insulin pumps. It's important to be prepared that students on insulin pumps may still require injections during cases of pump or pump site malfunction. Some students on insulin pump therapy may also return to injections. See the student's current DMMP for therapy. Insulin works best when it is injected into a layer of fat under the skin above the muscle tissue. Rotating sites is important to insulin absorption. Common preferred sites are the abdomen, thighs, buttocks, and upper arms. Students should help choose injection sites. Insulin syringes come in different sizes. Syringe sizes that are available are 1/3 cc or 30 units, 1/2 cc or 50 units, and 1 cc or 100 units. Generally, each horizontal marking indicates 1 unit on 30 and 50 unit syringes and 2 units on 100 unit syringes. However, some students may use 30 unit insulin syringes that have scales for both half and whole units. Needles and syringes should be disposed of in a manner consistent with universal precautions and local waste disposal laws. For the syringe and vial method of administration, you will need to gather your supplies. Those supplies include insulin, syringe and needle, alcohol wipes, gloves, and a sharps container. Be sure to verify the type of insulin before drawing up into the syringe. Wash your hands and apply gloves. Clean the rubber top of the insulin vial with an alcohol swab. Have the student select injection site per the student's DMMP. Common sites are the upper arm, thigh, stomach, and buttocks. Clean the injection site and wait to dry. Check the insulin dose. Verify each of the following: the student, the insulin, and where and how the insulin is supposed to be delivered. Also, verify the specific dose for conditions. Remove the cap from syringe. Do not touch the needle. Pull the plunger down to the number of units to be administered. Push the needle into the bottle and push the plunger in with the syringe tip down. This will inject air into the bottle to prevent the development of a vacuum. With the needle still in the bottle, turn the bottle and syringe upside down and pull the plunger down to prescribed number of units of insulin as per the student's DMMP. Check the dose and type of insulin with DMMP specifications. Pinch up the skin to avoid injecting into a muscle. Push the needle into the skin at a 90-degree angle. A 45-degree angled approach may be recommended for lean students to avoid intramuscular injection. Release the pinch. Push the plunger in. Count to 5. Remove needle and dispose of syringe as per the student's DMMP and local ordinances. Never recap a needle. Document the time, dosage, site, and blood glucose values.